And now we turn to Joanna Hernandez, who spent the day in Roseland as part of our In Your Neighborhood series. Joanna.
Thanks, Brandis. We're now here with Dr. Khurram Khan. He is the Chief Medical Officer of Roseland Community Hospital. Thank you for joining us tonight.
You're welcome.
So I want to start off first, as COVID cases are winding down, what impact has COVID had on the Roseland community that has long faced with health disparities?
I think it's had a significant impact due to we get the sickest, the most comorbid patients that come in with COVID. And I personally treated patients that have poor access to health care in the community, lack of resources, lack of primary care and education that's needed for the patients. So we've had the sickest patients with the most comorbidities that come into our hospital and get treated for the COVID.
And as a doctor, how do you also keep these patients' spirits up? Right?
It's very challenging, but I think that the most important thing is giving them hope and letting them know that, at Roseland Hospital, we've been in front of COVID with our testing. We've had testing since the first wave of the COVID with our vaccination. And more importantly, we've had the latest treatments as the CDC has approved and FDA has approved. We've been using those on our patients that come in.
And a few years ago, Roseland was struggling to stay afloat. Where does the hospital stand now?
Well, we have funding challenges. Most recently, after the last Omicron variant, we've had issues with nursing staffing and then price gouging by the nursing agencies to where we're in debt due to mainly nursing, but also, limited on resources. And we really need help from the state government and the Medicaid organizations to help fund the hospital so we can appropriately treat our patients.
Would you say this hospital is a necessity in the community?
Absolutely. The hospital is going to be coming up on its 100th anniversary in 2024. And we see over close to 35,000 acutely ill patients coming in through our ED doors a year. And with the COVID, we've seen, it's been lines in the ER of sick people just last month in January, where I've had to, literally see patients with the ventilator in hallways. So it's been a pretty dramatic impact.
Now, part of that effort also, I want to switch gears here, is to raise funds for the Roseland Medical District. Now, tell us about those efforts. Yes,
the medical district is, it's sort of like, I know you're familiar with the Illinois Medical District that we have, and the efforts are to bring in other subspecialties and primary care into the community of Roseland, but we cannot have a medical district without Roseland Hospital present on the table and involved in the plans, as Roseland is the hub in a medical. It's basically a desert where we provide all types of care for the community.
Now this is the last question. We only have a couple seconds left with the mask mandate uplifting. Are you concerned about there being a surge?
Not so much a surge, but definitely can be a pickup in cases because social distancing and masks are very important, along with the vaccination, to keep our cases down.
Well, thank you, Dr. Khan, for joining us tonight.
Thank you.
Now, coming up, we speak with a local organization who is assisting the youngest people in the community. Stay tuned.